He's got to get out of here.
I was trying to make sure that Antrim County heard me.
So.
You'd rise, please, for the Pledge of Allegiance and our invocation.
Pledge allegiance to the flag, United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Father, for this day, for the opportunity to gather again. I just pray that you would guide and direct our words, thoughts, and deeds. In Jesus' name, amen. Good morning, everyone. Mel, can we have a roll call, please?
Commissioner Mason.
Here.
Commissioner Turnbull.
Here, good morning.
Good morning. Commissioner Hankins.
Here.
Commissioner Chamberlain.
Present.
Commissioner Mapes.
Here.
Commissioner Aaron's. Commissioner LeBanway. Here. Commissioner Van Alstine.
Here.
All right. Would anyone like to add or remove any agenda items from our current agenda? Hearing none. We'll move on to review and approval of the meeting minutes from February 6th. Anyone like to make a motion
I'll
there?
make a motion to approve the meeting minutes from February 6th as presented.
I will second, but there needs to be an amendment.
Well,
I-
okay, I'm gonna take, Mr. Chamberlain actually spoke
Oh,
first, so he'll be the second. Ms. Levanway, would like to make an amendment.
yeah, there needs to be a correction. And I'm trying to figure out where it's at. It was on the
Sure.
committees.
Personnel and Finance Committee.
It was under Personnel and Finance.
It shouldn't be Commissioner Mapes. It should be Commissioner Aaron.
Yes.
I'm sorry.
Your microphone didn't work.
Under the Personnel and Finance Committee, it should read Commissioner LeVanway will remain the chair. Commissioners Mason, Aaron's, and Hankins will remain on the Personnel and Finance Committee. I accidentally wrote Mapes in there.
So read that again, because now I'm confused.
I'm sorry.
Read that again for me, because now I'm confused.
What was written is Commissioner LeVanway will remain the chair. Commissioners Mason, Mapes, and Hankins will remain on the Personnel and Finance Committee. What needs to be corrected is not Commissioner Mapes being on the Personnel and
I
Finance.
see that. now.
However, Commissioner Aaron's is on the Personnel and Finance Committee.
That just needs to be
I'll-
fixed.
I'll redo my motion to accept the minutes as amended.
Okay. You get with that friendly amendment?
Yep.
Okay. Any further discussion or changes, alterations? Hearing none, can we have a roll call, please, Mel?
Commissioner Turnbull,
Yes.
Commissioner Hankins,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Mason,
Yes.
Commissioner Aaron's,
Yes.
Commissioner LeVanway,
Yes.
Commissioner Mapes,
Yes.
Commissioner Chamberlain.
Yes.
Motion passed.
Thank you. Ladies and gentlemen, that moves us to public comment. You will have 3 minutes to address the Board of Health. We would ask you to step to the podium, state your name and where you reside. I'll start the clock then, and I will give you a friendly warning at 30 seconds. Would anyone like to address the Board of Health? Here comes my list. Thank you, sir. Steph J. from Otsego.
I'm Stephanie Jacobson. I'm from Otsego County, and I understand that there's been some good discussion about possibly holding meetings in the respective counties you serve. And I'd like to just encourage you to continue that discussion. I think this marks 3 years that I've taken time to drive over to these meetings now at my own cost and at the cost of quite a bit of time. And I think since all 4 counties fund the health department, it would be nice to have a meeting there now and again. I feel like we're in the seat of the health department, and sometimes that can kind of be an echo chamber, and getting out amongst the other communities you serve would be good. I also think there is a group of counties in the health department that do make this a regular practice. And so maybe a little bit more research into the costs and some of the pros and the cons from that area would be beneficial. Just to get out there and show the people what you're doing. I know 3 of the 4 counties are in that position, as well as I am. And it is very time consuming to come over these meetings. We drive about an hour to get here. So I just encourage you to continue that discussion, continue to look at, the issues that you would have in doing that and maybe some solutions. I think that would be productive for all members of District 4. Thank you.
Thank you. Anyone else like to address the Board of Health?
Mary Lieberman, Emmett County. In reviewing today's agenda packet, I see that there will be a resolution proposal from Commissioner Mason. This concerns me as I don't believe that it is the responsibility, the right, or the role of this body to insert itself into the governing procedures of our 4 individual counties. Surely, before giving this proposal resolution any further consideration, I would expect that it be submitted to the Health Department's attorney, Matthew Cross, for legal review and guidance. This would be the prudent and diligent duty expected of this board. Thank you.
Would anyone else like to address the Board of Health? Hearing none, we will close public comment and move on to staff reports. Mr. Thorell.
Okay. All right. Sounds like my mic's working. All right. So, couple things I wanted to talk about today. One of them is My Thrive, which is our community health needs assessment. This is, we do a 3-year cycle for My Thrive. This would be the 2024 to 2026 cycle. So basically, My Thrive is a partnership between 7 local health departments and 5 healthcare systems and other community partners in our 31 county region, which is basically Knuckles North in the Lower Peninsula. And really what this does with a community health needs assessment, it collects a broad range of data that that affects health of our citizens. So it could be social data, economic, environmental, behavioral, as well as healthcare data. And so why do we do this regional approach? Basically, in the past, in the way past, this started in around 2014 or so. Everybody was doing these community health needs assessments. The healthcare systems, they're required, right? Health departments are required to do these assessments. Everybody was doing them individually, very siloed. Everybody was, working, separately. And so to leverage resources, to leverage experience, to be more efficient, we pulled this group together to basically do one report because there's more than one report, one effort to create 3 reports that line up with our community health innovation regions. And it's just a more efficient system to have the partnerships. It's more cost effective because, everybody doing the same thing is just not a good plan. So really the way that this works is there's primary and secondary data that's collected. A lot of the primary data is from surveys and focus groups. So we're actually talking to citizens in the region to understand like what their healthcare issues are, what their barriers are, things of that nature. And then also there's epidemiologists that are on staff at some of the different health departments in our region that are looking at the local, state, and federal data sources for vital statistics and things that are collected to determine what is the state of the health in our region.
We basically have three phases of My Thrive. Phase one is to build the Community Health Foundation, which is basically pulling the team together. This is health department led. So there's health department staff members that are going to be working on this throughout the 7 health departments. We're leading this charge at Northwest with our community health planner, and whose name is Emily Uray, and then also Holly Campbell, the deputy health officer, has a hand in this, overseeing that effort. So basically pulling the team together, planning the strategy, and funding. So everybody, including the hospital systems, are putting money into this effort. And again, it's cheaper, more cost effective to do it this way. Phase two, telling the community story through 3 assessments, which is part of this unified approach called MAP 2.0, mobilizing for action through planning and partnerships. So there's 3 components to that: community partner assessment, where mainly the providers are looking inward to determine how their system is set up, if they are considering the needs of the clients that come to them, whether it's a healthcare system, a health department, or some other community partner, is to make sure that they are not creating barriers to people using their services. There's also the community status assessment, which is really that qualitative data that has to do with the vital statistics. And then the community context assessment, which is more qualitative, that involves community input. So, and then phase 3 is just to continuously improve the community's health. And a lot of this data is going to be compiled. And then in this round, we're using a data platform called Conduit, which is going to be used to compile the data and then be able to create dashboards. And basically you can go onto that system, anybody can, and look at a particular area, look at a particular county, and pull the data out of that. And that's going to be helpful for healthcare systems, health departments, or even other community partners to apply for grants to bring in funding to deal with a certain issue that may be a barrier to healthcare, or even looking at what the healthcare needs are for certain populations within our region. And again, just to reiterate, this doing it through a regional approach, it just leverages the collective wisdom, maximizes resources, maximizes efficiency, and again, satisfies that mandated requirement. And we're not being duplicative. We're not being siloed. We're looking at our region, because so much of, you think about like the healthcare systems like Munson, it doesn't stop at county lines. It goes beyond that, or McLaren, or Ascension, or Corwell. I mean, all those healthcare systems, they don't just stop at county lines or jurisdictions. I mean, they influence the entire area. So the health department in Northwest Michigan's share of My Thrive is $37,000. And I can tell you, if we were doing this on our own, it would cost much, much more. So it's really a good deal. The total budget for My Thrive is about $620,000, which hospitals, like I said, the 7 health departments, hospital systems, we're all putting in the funding to cover that budget. It's based on population. So like Grand Traverse has a similar population that we do, so their amount is about the same. Benzie-Leonard's about half of that. Other regions like District 10 Health Department is like $100,000 that they're putting into this. And then the hospital systems are putting in, their amount based on their service area. So it is, I think a very successful program. Like I said, we've done this for a few cycles, and it works very well as far as partnering together to do these things that we already have to do anyways. So, and another important thing to talk about too is that our costs at the health department level is covered by a workforce development grant. So for this cycle, we don't normally, we would have to use local dollars to pay for something like this. But in this case, we don't. So it's a really, it's really good for us in this cycle that, we can count on the workforce development funding to help us make that contribution. Does anybody have any questions about my thread?
I do.
Okay.
Is it fair to analogize this to, say, a county doing their master plan? Only
Yes.
is over a regional area.
Yes.
I'm a former educator and I like to cast things in different, different realms so people can understand things better. So.
Yes, actually, it's a great analogy, because counties, when they do their master planning, they have to use that master plan to, if they're applying for funding, that's something that they would submit. That's something that funders would require. It's the same thing with health departments or healthcare systems. They have to provide that community health needs assessment.
Thank you.
Do we need a motion to have you go forward with this, or?
We do not, because we budgeted for this,
Okay.
which was,
Great.
in the approved budget. So I just wanted to, make the board aware of the cycle starting and just everything that was involved with, the cost and, the things that were going to happen. Okay, so the next thing I wanted to talk about was at the last meeting, the February meeting, I was asked to put together some costs surrounding rotating the meetings to our different county locations. We have 4 counties in our jurisdiction: Antrim, Charlevoix, Emmett, and Otsego. So I put together a table of those different locations, and we used, I used, the locations that we would recommend based on the information that we gathered. Melanie was a big help with pulling the information. She called the different locations to get the details on what would be needed. So in Otsego County, we have a it's an old space, but we freshened it up with some carpet and some paint, put some new tables and chairs in there and some audio and video stuff. So that facility at our health department office in Otsego can hold 85 people. The total cost, and this is counting mileage from the staff that would be attending, and then also just looking at staff travel cost as far as time goes. Like if it takes 2 hours to drive there, there and back, I wanted to put that cost in there as well. Although that cost, is being paid anyways. The mileage is above and beyond, right? But to just kind of give you an idea, so per meeting, it would be about $1,500 at Otsego. Antrim, we looked at Helena Township was really the best option for us. It's similar, about $1,400 and $1,459 would be the cost. Emmett County, we looked at a couple different options. The Carnegie building can hold 80 people. We weren't totally certain that we could use it on that date, and we haven't got that information flushed out yet, but that'd be $744. And then the Emmett County Fairgrounds, which there's a cost to use that, would be at just over $1,000 at $1,068. And then there is a cost, I just wanted to throw in there the cost of being here at this building is $582. One thing that got in, I didn't realize this until yesterday late, at the bottom of that spreadsheet, there was a bullet that said a one-time cost of $4,922 for mobile audio video equipment for alternate locations. So that's Tim Hella put that together. That was for, anything that we need for recording the video wise, and also microphones. So we can continue to broadcast, continue to record the meetings. So there's details down below, and the highlight in green is where we would recommend going to, although, there's other options there. That, if the board has questions or anything about that, we can look further into those, but, that, we just kind of wanted to lay out the details here.
Anybody have any questions for Dan regarding that?
Yes, sir.
Mr. Mason?
Dan, I thought, perhaps if sorry. Okay. Sorry. Like the Gaylord location, I see you've got that. You questioned the library, but perhaps the Friends of the Library could move to a different time. I think I wouldn't mind if John and I were to look into something like that in Gaylord, because that would save the setup. And there was another thing here. Why not alternate even, say 2/3 in Charlevoix, which would be 8 meetings, eight meetings in a year, as opposed to 4 meetings all, or excuse me, with the other 3 counties, twice a year in the alternate counties. And it would leave 4 meetings for Charlevoix here. And also the Zoom issue, staff, with all the staff, now I see you cut down some of the staff as some to, as composed and compared to the past. But how many have to be necessary with you? How many staff would you have to bring with you?
Well, it's typically, the staff that are normally here. We have IT staff and then our directors, program directors, which I think is really important. Holly couldn't be here because she's not feeling well.
Okay.
And we didn't want to make everybody sick. So, yeah, so, I think pretty much everybody else is here, other than Holly. So, but I think it's important if we're going to have a productive meeting to make sure that we have the staff in the room that can answer questions that may pop up that I don't necessarily know all the details about.
Well, they would have, because of Zoom, they would have the capacity, would they not, to be able to contribute from perhaps their office space or wherever here in Charlevoix, they would Zoom to also, being staff. And as far as the IT, I think our own communities have the IT set up pretty well in place for that. You wouldn't have to bring them all the way down here, down to Gaylord or Petoskey. Is there any possibility that those things could be worked out?
I think, the possibility of having staff participate by Zoom, I would rather them be there in person, but they could participate by Zoom. And I learned a long time ago that I would rather have my IT staff where I could look at them and say, come here, help me with this. Yeah. To where, I think it's important that they're present, just because there's just things that pop up and I don't want to, delay a meeting or, have something happen where we can't do what we normally do. So I would want to make sure that we can do that. Yeah, I think really, this is a board decision. In the bylaws, it says that we'll have, meetings in Charlevoix, actually it says the health department, and the board decided to go here because we had space issues at the health department. And really it's a board decision on, where you want to have meetings. I think one thing we have to be cognizant about is, just making sure that everybody, if meetings are held at different locations, that then it's, we have to be more diligent and really careful about making sure that people know where to go, right? Because we don't want people showing up at the wrong location, which I think in the past, my understanding is there was some rotation of meetings, and that happened routinely where people showed up at the wrong spaces, the wrong places. So if we were going to do that, I would want to make sure that we're, really careful about that, because I don't want people to go places where the meeting's not being held and then realize, you know, it's somewhere else. Yeah.
We have just a little bit of feedback and it's not bad in here, but I don't know how that might be affecting the Zoom.
Is it right?
Perfect example.
Okay, that sounds better.
I got it.
Yeah, thanks.
Thanks, Chris. That's why you take your own staff with you.
Exactly.
And the alternate locations may or may not have people who are trained to resolve issues like that or to resolve issues with Zoom. Where would the funding come from, Dan, to cover these costs, to go to different counties and to make purchase of the mobile AV equipment?
It would have to come from our general fund, basically.
Okay.
Yeah, from local dollars.
How much staff would you necessarily have to bring? Is there some, I know there's IT at the library. In Otsego County, I can't speak for Emmett or Andrew. They have, if you're talking in separate buildings, then they're like the commissioners' meetings in Antrim, right? You're not talking about using their.
Well, we did ask about that, but because of the parking and, you know, other issues, I mean, in the space inside there wasn't, you know, not terribly huge. It is an option possibly. But the person that Mel talked to there, you know, recommended against using that space, that there might be better spaces to use in Emmett. But, you know, if I'm thinking about it, you know, the farthest apart are Charlevoix and Gaylord, right? So, you know, between Charlevoix or Gaylord in Petoskey, it's a little less.
Yes, it is.
Right. And, you know, probably the same thing with Antrim. So I don't know. I do have concerns about, you know, moving it around in every single county just because of my concern about people showing up at the wrong place and just human nature. And I'm not talking necessarily like us, but, you know, the public that would like to come to a meeting. So I think we would want to make it, you know, if that was the board's desire, to make it as simple as possible.
Mr. Van Alstyne.
I'd like to make a motion that we leave the meetings here at the county building at the Shirley Roloff Center. Reasoning behind that is, we've been talking about being fiscally responsible, and I see a huge waste of money that people can watch the meeting after it's done. They can comment to the health department. I see no sense to spend the extra money to move the meetings around.
Second.
There was a motion from Mr. Van Alstyne. Was there a second? I'm sorry.
I seconded.
Mr. Aaron seconded. Is there any further discussion?
Mr. Chair.
Mr.
Yes,
Turnbull.
I mean, we've heard from two individuals within the district that have requested that we rotate this. There is a way that we can do this. There's always a way to accomplish the task. And in the time where, I mean, you know, we're reeling back from the lack of trust, I guess, the community had within HDNW, and we're rebuilding the trust with the people. I mean, this is one way I think we could really get a win in, you know, providing not only just that trust, but everyone here talks about transparency. And what's more transparent than going out, you know, getting into the community, and so going to the different community locations rather than make everybody come to us. Why don't we go visit everybody, so to speak? So there is a way to do it. I mean, like reading through, no offense to Dan, but reading through like your report, I mean, is very negative. We can't do this. We can't do that. It's going to cost this. It's going to cost that. rather than, so you're focusing on the negatives rather than this is how we accomplish this. There is a way that we can do this that would be not only, everybody within this board could, respect, focusing on that, like the common sense of it, but also, this is something that the people have asked us to look into. We've been asked to rotate the locations, so I am in favor of, rotating the location of this building or the board. Thank you.
Mr. Chambers,
Sure.
go ahead.
Dan, what was that figure for the equipment?
Yeah,
I
I'm
don't have-
sorry. It is $4,922. And that's a one-time cost, where the other ones, if you look at like the total, it's a total cost per meeting.
Chair.
Sir.
I actually had the same kind of an idea with our county commission meetings years ago before I ever ran. But I didn't know the logistics. I didn't know how it was going to even work. I didn't work out as much as this has worked out. But, considering we have Zoom now, we have transparency. I mean, everybody's got one of these in their pockets these days. They're walking around. Okay. You can go Zoom on your phone even. So you want to travel that far, go to a Wi-Fi free parking lot. Those exist too. Or in your towns, you might have Wi-Fi free. So although I agree with the sentiment of it, but the practicality and reality of it is different. And sometimes we have to measure those things and weigh those things. And I'd say we're perfectly transparent the way we are. I mean, I attended the last meeting by Zoom from Florida. I mean, it wasn't hard at all. So
Mr. Chair,
Sure.
I would like to ask, Shannon or one of the people doing Zoom, how many people do we have on Zoom currently? Do we have the number? 31?
31.
Thank you. So not a great turnout for Zoom, and I mean, Zoom's not been, I mean, we have Zoom within our county Board of Commissioner meetings, and we decided to stop doing Zoom because it was not an effective means of relaying information. So I would just disagree.
Well, I think I've been here longer than anyone else on this particular board. I can tell you that when we had a board meeting in Emmett County, there was not a huge turnout. When we had a board meeting in Mansalona, there was not a huge turnout. And I would also take issue with your characterization that Dan's report is negative. Dan did what we asked him to do in coming up with the facts and figures of what was involved, and that's all he reported. I don't think Dan has a dog in the fight, so to speak. I don't think he minds where we meet, but this is the expenses that are attached to that. I think that it is important that our directors are in person. Zoom is great. Computers are great unless they're not. And when they don't work the way that they're supposed to, or when we have a great PA system here in the roll-off center, and people still complain that they can't hear us. So I don't have a lot of faith in the technology. I think the directors should be present. I think the IT staff should be present, because when something breaks, we need to try and make it work as quickly as possible. And I'm in agreement with Mr. Van Alstine. This is money that I've had, I think, one email, maybe two, regarding this. That I don't think people are up in arms that they're not seeing their health department. I think we are very transparent. I think if somebody does want to take the time to attend via Zoom, they don't have to get in their car. And I would be in agreement that I don't think it's a good use of taxpayer dollars.
also add that
Go ahead.
we have this advisory committee now, right? Is that what's with the groups that you travel around and meet with everyone? And that's really helped, I think, the health department too. And that little committee.
Any further discussion?
I do believe, Mr. Chairman, that and I don't question his study as far as it is taken, but perhaps, you know, offering alternate locations less often than holding them here is a possibility. And perhaps there are other locations to look at. In myself, I think that we could do better even that with the library, we could come up with those meetings on a Tuesday morning. That's just my opinion at this point. It may be wrong. And I don't know. I don't take offense either way to what John had to say, or, you know, I don't know that Dan's opinions are negative on this issue. I do think it's to the advantage of the board here to be able to the executive unit here to justify keeping it here with some of these numbers. But I think these numbers could be changed fairly well. And I do believe there are maybe one or two people in the staff that wouldn't have to be present along with IT. If you find the right buildings, put it in. And the idea of, I would oppose spending $4,000 or $5,000 to put in new equipment in some of the buildings you're looking at. So I stand that ground with John. Anything is possible. Maybe a lot more legwork. Shouldn't all be yours. As commissioners, perhaps we could look a little closer ourselves to find the right places. And certainly it isn't something that has to happen immediately. It could take 6 months. It's just something for the future, and those that like to attend would like to be here in person in their own communities. That's pretty much it.
Mr. Chair.
Mr. Mapes.
Yeah, Dan, could you remind me what all is already available for folks to partake in the health department meeting? Now, I understand if they're watching the video, they can't make public comment, but could they send in public comment?
Yes.
By email or something?
Yes, there is. So if they send in, there is a cutoff time to send in public comment, and then those comments are forwarded to you all through your email. And then I think if anything is submitted after that time, then it goes to the next meeting. Okay. Yeah. So we do have a process for that.
Okay, so I agree, with the expense of that kind of an operation. I don't think it's an excuse technologically for folks not to be able to partake in the meetings. Everybody has a phone. Like was already previously stated, everybody has a phone or has access to a computer, or do we do YouTube?
So what we do is we do the meetings through Zoom, right? And then I believe once they get posted, they're on YouTube,
Okay.
but they're live on Zoom, like right now.
Right now.
Okay,
Yeah.
you can watch. And then after the meeting's done, like the next day, they get posted to Zoom. Or I mean, YouTube,
So yeah,
sorry.
there's another opportunity for people to watch. I don't know. A lot of people don't have YouTube.
Right. And then we also on our website, we have, you can go on our website and get to those.
Ms. Levan.
It sounds like we have many ways. I've had many people tell me they go and watch the meeting after the fact and they like it that it's there. I have a question. Does Otsego County do this for their county board meetings?
The Zooming,
Do you do live?
we are not now.
You might think about it. How about Charlevoix?
Yes, we do.
Does Emmett County do that?
Yes.
Yeah.
Not video.
So that might be something we consider, that we go back to our counties and try to get our counties live, because a lot of people use it. If we're trying to make this place transparent, maybe we should make our counties transparent too. And maybe that would help the health department. so that people can see what you're talking about at your county board meetings. Just a thought.
I
But
would
people
like
can come
respond.
to our meetings because it's co-located. But
I would like to respond to that. Our Board of Commissioners today is making it far more transparent than I've ever known it to be. And that's with the new board that formed in the last year and a half now. So Zoom doesn't accomplish what the commissioners must in their own locality take care of in
Oh, okay, I'm gonna, I don't mean to cut you off, Henry, but we are discussing Mr. Van Alstyne's motion, and I don't want to go down a bunch of different trails about what counties should or shouldn't do. Is there any further discussion regarding the motion? And Mr. Van Alstyne, I'm gonna paraphrase, but your motion was to continue the meetings here at the Charlevoix location from a fiscally conservative standpoint. Is that correct?
Correct.
Is there any further discussion regarding that motion? So we're going to ask for a roll call vote. An affirmative vote would be to continue meeting at the Shirley Roloff Center here in Charlevoix. Is that a fair
Correct.
summary? Okay. Mel, can we have a roll call vote, please?
Commissioner Levanway,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Hankins,
Yes.
Commissioner Mapes,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Turnbull,
no,
Commissioner Mason,
no.
Commissioner Van Alstine.
Yes.
Motion passed.
All right, thank you. Does anyone have any questions regarding or for our medical? I'm gonna mess this up. Does anyone have any questions for our directors regarding the written reports that are part of your packet?
I have one for Dr. Myerson.
Mr. Chamberlain?
Hi, Dr. Myerson. Good morning. Are you guys, this was a great report, you know, looking at all the different diseases. Are you guys keeping an eye on the Lyme with this mild winter with more ticks being present probably in the, I guess, the spring?
Yes, with regards to tick-borne illnesses like Lyme disease, we've been talking about that, Dan and I and Jeremy, that we expect it will be an early and pretty robust season with ticks, and we are, you know, planning to continuing the messaging that we have done in the past, because I think it's just part of our reality here with this, you know, the price we'll pay for a mild winter.
Yeah, I was just amazed how much it's been going up. And you look at the mild winters, and we had a lady stop in to visit me, and she carries a tick puller on her keychain. I mean, it's just how she's worried. She's out on her side by side all the time, and I guess that's a new reality to have.
There's a program out. I don't remember where I seen it, but you can go through the state of Michigan and do it online, and you can become a Michigan tick certified, so you know what ticks which. I think I seen that on Yahoo maybe or something, but you can take a class. It's all online, and it'll tell you about which tick is which and which ones are bad and good and
Thought they're all
of
bad.
that.
Yeah, and you can submit a photo of a tick to the MDHHS website. So if you find one, you can submit it
Hmm.
and they'll identify it for you. So if you go to their website. Yeah. So there's some good resources out there, but yeah, that is definitely worrisome. Especially the increase in deer ticks or the black-legged tick with Lyme disease. I mean, it's in our area, it's not as bad as it is on the coastal areas. But it continues to, you know, we see that numbers keep on rising, even though they're small. But if you look back 3-4 years, I mean, it's significant.
Sir?
Jeremy, could you give us a little bit of up to speed so the people online and stuff can understand it about the septic tank replacement loan program?
Yeah, sure, Terry. So the septic replacement loan program, it's a new program. It's going to roll out in April. And how it became Eagle actually helped fund some of the program. And they are working with Michigan Saves. And that is, it's basically a credit union that people, if they have a failing septic system, they can go in and apply for a loan to help with the costs of the septic replacement. So there's two tiers in this loan program. The first tier, it is income-based loan for homeowners. It's the criteria isn't it has limited use of traditional credit factors. So it's more about your ability to pay instead of your credit score. And the interest rate on that loan would only be 1% for those people that meet the income limits. So I could give you a real quick example. So like a family of five, the maximum income would be $70,280. So if they made less than that, they would be able to qualify for that loan. The second tier loan, that actually is available to everybody, regardless of income, and that interest rate would be at market base. And it is a credit-based underwriting criteria for that too. We're fortunate in our 4 counties that our septic code it meets the requirements of this. And there's a lot of health departments downstate that wouldn't meet the requirements, where their community members can actually take advantage of this loan program. So we're really fortunate with that. Our district sanitary code meets the requirements. The contractors, they have to register, they have to be insured. We've already sent out emails to contractors, letting them know about the program. We actually had a meeting recently in Antrim County. And we had one of the Michigan Saves representative come. They did a presentation for the contractors, and we're starting to get more information out to the community members right now. So that's kind of the gist of that. Any more questions on it?
Jeremy, and I appreciate you, first of all, I appreciate Terry's question to let you explain that a little bit more. Are these documents on our website as well?
Not yet.
Okay,
We'll be getting these up soon.
perfect.
So,
Thank you.
yep.
This would have worked great when I bought my first house. Start off with, I gonna.
Well, and Josh has got 14 kids.
We could have put a brand new septic, so it was either, try to tell my wife, we can either have a garage, an outhouse, or we can have no garage and a septic, and.
I know who did your septic.
Yeah, right. That was a nice welcoming present.
Do you have a timer on the shower?
Yeah.
I'm pretty sure. I know how to shut the valves off.
Next Wednesday, at the Emmett County Fairgrounds, there is a lunch with or breakfast with the inspectors. Maybe we can get the information out to them.
Yeah, that would
for
be a
that,
good time.
because you'll have, hundreds of people in the audience there.
Yeah,
be-
I'll get with you, Neil,
Sure.
after the meeting
Sure.
and get some more contact information for that.
I'd say just a little bit more, on top of Jeremy, great job outlining the information on here. I will say that it's $35 million. The idea is that because of loans being repaid,
Mhm.
that money, that we'll have a program that'll be sustainable. We do have some concern, I don't know if you remember the free water testing. There was like $5 million allocated to free water testing back, I don't know, it was early summer, I think. That $5 million lasted for about 10 days. And then it was gone. So, we're hoping that, as Jeremy said, the criteria that they're putting, because basically Eagle said, we're not going to pay for substandard systems to go in. And they're talking about, there's like other health departments, like Jeremy said, throughout the state that they don't have very strong sanitary codes, and they put in systems really close to groundwater. And Eagle said, we're not going to, this loan program is not going to do that. Like, you have to meet the criteria that we put together to put in a system that we think is going to be totally protective of public health. And like Jeremy said, here in Northwest, we're fortunate that our code is that would match that. We are protective of public health. a long time ago, that decision was made to, have a strong sanitary code to protect the natural resources and public health of our community, and that's paying off. In more ways than one, but definitely in this arena as well. So I think our citizens will have access to this, have a better chance of using these loans than maybe other parts of the state.
All right, thank you, Dan. Any other questions for any of our directors? Hearing none, we're going to move on to committee reports. Personnel and Finance Committee.
Under the bills accounts payable, I'd like to make a motion. The Finance Committee met to review the bills and employee expenses and would like to make a motion for the full board to approve the January 2024 bills in the amount of $675,734.75 and the January 2024 employee expenses of $18,548.93.
Been motion, is there a second?
Second.
Seconded by Mr. Mason. Any discussion? Hearing none, can we have a roll call, please?
Just to have it on record, that was Commissioner Aaron's that seconded, correct?
Mr. Mason actually seconded.
seconded?
They both did, but I
You
think I heard
corrected
Henry a
that
little
one,
bit
Thank you.
before.
Commissioner Levanway,
Yes.
Commissioner Mapes,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Mason,
Yes.
Commissioner Hankins.
Yes.
Motion passed.
Okay, and the next thing on the committee report is the breastfeeding lead job description addition. And the Finance Committee met this morning and we had a tie on the motion for the job description with the breastfeeding lead. So we have to bring this to the board to let the board decide, and I'll make a motion to add the job description of the breastfeeding lead to the Health Department of Northwest Michigan Council classification schedule in a level 7.
There's a motion. Is there a second?
Second.
Seconded by Mr. Aaron's. Is there any discussion?
I
Can you
think
give us a little
Melissa,
bit more background on this?
Melissa needs to explain this.
Yeah, I'll let Melissa Hahn, our Family Health Director, speak about that.
Thank you. The breastfeeding lead position that we are coming to you with is a higher level breastfeeding position than what we currently have. We have 2 peer counselors, which are, just as that sounds, moms who have breastfed and are able to support other moms in breastfeeding. This position, the breastfeeding lead, would work with those peer counselors, work with the community, work with direct clients that needed additional support beyond what a certified lactation consultant can do, beyond what a peer counselor can do, beyond what most pediatricians are trained to do, to be honest. The certification is International Board Certification of Lactation Consultants. It is 60 hours of breastfeeding specific education, 1,000 hours of breastfeeding specific work, a certification exam, and all that needs to be renewed every 5 years. So these lactation consultants are the highest, this is the highest level of lactation certification that you can have. These services are for those families who need additional support. We know breastfeeding is the prime example of what we do at the health department. It's prevention. It is looking at what can we do upstream to provide healthy families, and in that, cost saving. This position is not something that we have had before, but probably should have. The hospitals call us when there is something further that they need assistance with, because we have a staff person that is qualified for this already. And this position would be allowing her to practice at that level and to help our community overall. in compensating for that. We have spent a lot of time looking how to fund this position because that has always been the concern. Is that our peer counselors are funded through the WIC program, but the WIC program does not offer funding for these specific services. It has been understood that you could get those in the private sector, but we don't have many certified lactation, international board certified lactation consultants, this IBCLC, in our areas. If you go out into the community, when someone asks you who you would call for breastfeeding, our staff person's name comes up at the hospital, the community level, nurses. She's called from the hospital quite frequently. And what we've done is spent the last year figuring out how to pay for this position. And because of her certification, she is able to bill for services that the rest of those certifications cannot, because insurances have realized how important that prevention is if we can help our families get a good start with breastfeeding, especially those that have more difficulties.
So a majority of the expense of this person would be covered by bill back to insurance companies?
Yes, we're not asking for any additional dollars.
I know, I wish we had this with our first one. Our first one's terrible. Wouldn't latch. We had to feed with a tube. Eventually.
And we have so many people. We have started, a lot of our nurses now have what's called a CLC, which is a certified lactation consultant. It's a 3-day training. I worked in the hospital and I was supposed to be the person helping you learn how to breastfeed because I was a labor nurse. I had 1 day of training in breastfeeding. And I was the expert. And so this is just really recognizing that breastfeeding could be super simple, but it might not be as well, and supporting those families that don't have that ease.
So just to do the math here briefly, you said this was in our previous meeting. This is 32 hours a week. Is that accurate?
Yes.
Okay. And the hourly rate is $25.50 per hour, which comes out to $816 a week times 52 weeks. That's $42,432 roughly. Benefit package, I figured at about 70% of that, so it's an additional $29,702. I'm sorry? Okay,
40%.
40%?
So I just
Okay.
also want to be clear that some of her position would still be paid for because she would be supporting the peer counselors. A piece of that would still come from the grant. What we looked at is that we could supplement the rest of it for the services that she's providing.
Okay, how much do you project this position would cost annually?
The position overall, when you look at it, is $53,040 as the salary. And then she'll add the.
About 20,000 in benefits if it's 40%.
I'm sorry?
Well, can you use the microphone? Thank you.
59,400 in total. Benefits and salary combined.
Okay. Is there any potential for that funding source through insurance to change? The reason that I asked that is this, I took a different job, obviously, and my insurance changed, and so did prescription rates drastically.
Yeah, that's for sure. We have worked. So when I started the health department, this was not something you could bill for.
Mm-hmm.
And we have worked really hard. This has been something you could bill for, I would say, for the last 10 years. It started with just a little portion that you can bill for. And then we have done more studies to show what the tremendous benefit and the cost saving So you see each year, additional private insurances have started paying this as well. So I cannot imagine that it's going the opposite direction. You're seeing more insurances cover it.
In the event they didn't cover it, however, this would be funding that the health department would have to come up with. Is that accurate?
Yes, and so if they didn't cover it, we would also be able to use our Medicaid match funding because if it wasn't covered, it would then qualify under that. We have a lot of different ways that we have been creative to build our breastfeeding program. And as we talked about in the meeting before, that's why our rates are higher than most other places in the state.
Chairman,
Sir.
Are you finished? Or did you have one?
Not right now. Go ahead.
I'm concerned. I talked to the dog.
Commissioner Mason, would you mind just putting the microphone closer to your mouth?
Sorry.
Oh, that's okay.
I'm concerned. Talked to my daughter this morning on the way over, and in December, she had a baby, and of course, everything was fine there. That was a home birth. It cost them $4,000, no insurance. They intended, that was no surprise to them, that it was all their choice. And she reminded me that had they insurance, not only would it have been the cost of the insurance, but approximately $6,000 to the hospital. They would have had to pay that much on top of the insurance. And so she felt their choice was much further ahead to go this route. She spoke to the lactation specialists, and I don't know that she saw any shortage. Of course, her midwife was a specialist. And I know that the mention is, well, gee, midwives are going away. Well, they're probably back. And if we go far enough with this program, it's always going to grow. I've never seen anything that happens in government that can't sprout a few more people. And it sounds very reasonable to begin with and tends to continue from there and grow cost. And I think there are a lot of young mothers now. There are a lot of, I know of 2 midwives, the midwife that handled her, and one locally has a young lady that I know studying for this. And with that goes at least their knowledge. $1,000 is a lot of hours. And it's great, I suppose, to have that. But practical experience, I understand the tongue-tied issue is present. You never knew it existed before today. But somehow we've managed. We've gone back to 70 years. Now we're looking at going back to what really worked was with the child, with breastfeeding. I guess that's it, Mr. Chairman.
Thank you.
Mr. Chair,
Mr. Turnbull.
may I ask, how many times has within the 4 counties, has the hospital contacted HDNW asking for help with the lactation consultant, breastfeeding coach, what have you, that individual?
I don't have a specific number that I can give you off the top of my head, but our staff have gone into the hospital hundreds of times, I would say, in the years that I've worked to deal with a more difficult situation that the staff hadn't seen before or didn't have the specific training for.
Okay, and a follow-up to that, so if this is being done already, what makes this position any better than what is currently being done? I ask you.
So we talked about that in the meeting this morning. The state came to us last year and said the money that they're getting for this program is being looked at a lot more stringently, and that this money is for peer counselors. And so we cannot be providing services at this IBCLC level with that funding. So if we weren't able, so then we've spent the last year trying to figure out how to continue providing those services for our community through the billing, through, you know, having this position. If we don't have this ability, when the hospital calls, we would have to tell them that, like, the services that we can provide are peer. And that we couldn't continue to provide those higher level services, unfortunately, because that's the money that's paying for that position.
Thank you.
Welcome.
Any further discussion? Mr.
Just
Mapes?
one question. Do we already have somebody on staff that meets this job description? Is that what I'm hearing?
We do.
And so this job description is just going to allow you then to build people that uses that staff person because they're qualified and fits in this job description to build their insurance companies. That's what I'm hearing.
Yeah,
Okay.
it allows us to allow her to use all of her knowledge and to provide those services appropriately.
So we're not hiring a new person to fill this position. We already have one.
What we would need to do, excuse me. So this person has been on our staff. She was staffed through MSU, and then has been a health department employee for many years since then. We would need to, some of what she's doing at that peer level would need to be backfilled, but we would only do that at a part-time level. So that's really what we would be adding, is a part-time.
Okay.
Any further discussion?
I just want to make one comment, Melissa. I don't know if you want to say more. I've had a constituent in my district who was a retired baby doctor from Beaumont Hospital that saved babies. And she came to me last year and wanted to help the health department. And she was very involved in this breastfeeding program and came to me and said it's one of the best she's ever seen and how wonderful this program is. And I don't know if you want to say something, Melissa, about this program compared to others.
Excuse me. We talked about this in the meeting earlier, and we brought this to the board, that we were one of 2 agencies that received a very prestigious award in 7 states because, and that that award has nothing to do with population, it's rates of breastfeeding. So babies born, what their rates are, and then the policies and how we help families. And we talked about, it's not that the population of babies is going up, it's that our breastfeeding rates are going up, which is the goal, and can lead to so many other great things on the prevention side.
Ian, do you
Further
mind if I
questions?
chime in?
I believe Holly Campbell wants to address the board, if that's okay.
Sure.
Yes, I just want,
Hold on, Holly. Can we turn the
Okay.
volume up on hold on for a second, okay?
Okay.
Okay, I think we got the
How's
volume
that?
up.
Okay.
Maybe not. Hold on. Well, while they're trying to figure that out, I would like to say something really quick is just, overall, with many of the things that the health department does, and I have a favorite quote. I'm a student of history, a favorite quote from Benjamin Franklin that an ounce of prevention is worth a pound of cure. And I think that embodies a lot of what the health department does. We try to address things upstream, way upstream, when they're small problems. Because downstream, if they're not addressed, especially with health, they become much, much bigger problems that cost our society are, we all know that breastfeeding is the best option for babies to thrive. They get a lot of immunity passed from the mother to antibodies and whatnot, from the mother to the child, plus the nutrition. And there's just so many benefits. And, I really think, by adding this position, it's one of those situations that we can address things upstream before they become issues and just be part of the whole community team. And I appreciate, what Commissioner Turnbull and Mason are saying about, there's other resources in the community is, pretty much what I'm hearing them say, but we work together in tandem with all those other resources. We're not, if we, maybe the hospital system that, has lactation consultants on board, I mean, we work together with them. We are not working in silos. And if there was not a need, we would not be asking for this funding. We are very careful from the health department standpoint of making sure that, when we add a position that we can pay for it. And we always have, taken that stance. So I just wanted to say that. Are we good?
How are we now? Is it better?
Hold on.
It's okay, Dan, if you guys can't hear me.
Okay, try again.
Any better?
Well, we had you for a second, but.
Okay.
We can move on.
Okay, sorry about that.
Sorry. Is there any further discussion? Go ahead.
Dan or Ms. you guys have been, the numbers of women that have sought help within, then for breastfeeding, coaching or lactation consultant here over the last year or so?
I'll let Melissa answer that.
And I don't have the specific numbers. If you, I can pull up some reporting that we have, but I don't have that specifically. It's offered to everyone. It starts currently because they're peer counselors paid through WIC. It starts as an offer to all of our WIC participants. And then we move as part of what we offer to everyone that has a baby as funding allows.
Any further questions or comments? My concern, as I expressed in the previous meeting, and I don't want this to sound like I love kids, I love babies. My concern is part of what Mr. Mason spoke to is that once a program grows, it continues to grow and it continues to grow. And I don't believe that government, and we, the health department, is government. I don't believe that government can be everything to everyone. And I am concerned about adding an additional position. And I know you didn't mention in the previous meeting that you would be backfilling with a part-time person, but I'm not in support of adding an additional position. That's my 2 cents. Anybody else have any questions, comments? Did we have a motion to
Oh.
add this?
Dr. Meyerson would like to speak. if That's okay.
Go ahead.
It's hard for me to not throw in my 2 cents too. Thank you, Commissioner Hankins. When I took this job in 2000, or when I moved here actually to Northern Michigan, back then the WIC program, if you're all aware of WIC, and we participate in WIC, and that's, your tax dollars are providing a lot of good things for moms and babies. And one of those, they spend a lot of money on formula. And when I came here and we all know that breast milk is the ideal food, and it's the best food for babies. Not all babies and families can have breast milk, and breastfeeding doesn't work for all of them. So I'm glad that we have formula available to them. But when I moved here, the hospitals all sent every mom and baby home with cans of formula. And if anything, we were encouraging formula use, and we had very low rates of breastfeeding compared to where we are now. Every time we can get a mom and a baby in that dyad to nurse, we're saving your taxpayer dollars, because we're not, that family doesn't have to go and buy formula and get formula, which can add up over several months. And I'm glad that we can supply that for the families that need it. But the more moms and babies that are nursing, the less money we're spending on breast milk. So there's on formula, sorry. So there is a taxpayer savings to and an incentive for us as a society in that regard to get families to nurse, as well as the clear benefits that the moms and babies have from it themselves. And I agree, many moms and babies, it's a natural thing, and they can nurse, and they don't need certified people coming in and billing insurance and medicalizing all of this. A lot of times it just happens naturally, but a lot of families, especially with their first child, struggle with nursing. It's not, I'm a pediatrician. I thought I knew a lot about nursing. And with our first child, it just didn't happen the way I'm like, oh, it'll just happen. And it didn't. And we struggled. And we had the benefit. I was lucky enough to live in an area and have the resources to have people come to our house. And we had, lactation consultants and lactation counselors coming to our house many times over many sleepless days and nights in that first month. And, I can be honest, I was like, let's just get some formula. It would have been the easiest thing to do. But without that support, that's probably where we would have gone. And instead, we were able to nurse, our first child. My wife could nurse, for his first year. And then with our second child, things went easier. It's just, it happened, and we didn't need all that support that we needed the first time. But a lot of our families really do need different levels of support. Sometimes it's something they can get from their mother or their neighbor or their friend. Sometimes they need a peer counselor that can help them. And for other families, they need this level of support. And it does come back to save us money in the long run.
Okay. Any further comments or discussion from the board?
Mr. Chairman,
Mr. Mason.
My own wife breastfed, and of course it wasn't that common at that time. But as we grow, and it appears it's picking up momentum and growing, as this happens, there will be, I would presume, less need for an expert, because mothers will be helping their daughters. Past experiences will become more prevalent in the present. And I still feel this is opening the door. It's opening the door to government in the home in more ways than one. We look at these things as necessary and innocent. In the end, who knows where, not that it has to come from here, but look at the mandates coming from the state that incentivize these programs, and where would the state take it in a few years? Looking at very recent past experiences with the state's new laws and mandates across the board. That's it, Mr. Chairman.
Thank you. Any further discussion? Did, you had, forgive me, did we had a motion to add this position? It was seconded by Mr. Aaron's, is that correct? Okay. So a vote in the affirmative is to add the position, a vote in the negative is to deny the position. Sir,
So it's. Motion was to add this position.
Correct.
Further, she mentioned that it was a no or a two vote for a no at the budget and finance was voted down. So is your position to support it, or is it their position the budget and finance recommend that it not support it?
It was not voted down. It was a tie. So it was brought to the board. It was not voted down. It was a tie.
well,
So I'm
that,
bringing
that
it to
would
the
have been
board.
a failed motion at the
But-
committee level.
but it-
But it is, she did make a motion to add the position in the full board meeting, and it ultimately it's for the full board to determine anyway. All right.
Yeah,
Sure.
we just, I mean, basically, I think, and I talked to the board chair just before the meeting, that just to simplify it, because it is a full board decision, to have it expressed this way instead of trying to figure out, okay, is a no a yes or a yes a no? I mean, in this way, it's just simple, right? So straightforward, right? And that's the reason.
So a vote in the affirmative or a yes vote is to approve the motion to add the position. A vote in the negative or a no vote is to deny the position. Is there any further discussion? Hearing none, can we have a roll call vote, please?
Commissioner Aaron's,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Levanway,
Yes.
Commissioner Mapes,
Yes.
Commissioner Hankins,
No.
Commissioner Turnbull, Commissioner Van Alstine,
Yes.
Commissioner Mason.
No.
Motion passed.
Okay. Moving on then to Program and Evaluation Committee.
We have a meeting after this meeting.
Okay,
About
so
it
you'll
right
have
now?
a great report for next month.
Oh, yes.
Okay,
Chairman, you're invited to that meeting if you want to stay.
no,
Okay, all right,
Thanks.
just checking.
thanks.
Okay.
But no. I'm about meeting doubts. Moves us to unfinished business. We have none. Moves us to new business. Resolution to the Antrim County Board of Commissioners. This was brought to us last month by Mr. Mason, and we asked that it be directed into a resolution so that we can vote on it. It's on our agenda. Mr. Mason, do you want to address this?
Yes, I feel, it is, in fact, the Antrim County Boards, it's not their decision, it is your decision to have made. But I've requested that the board at least discuss this with you. It is not a mandate. It is not forced on them. But it leaves many questions for a lot of people. Juris, usually you remove someone because they've requested removal or they've done something to deserve removal. Juris is an intelligent individual and very active on the board. He certainly had a different point of view than many of us. And so I would request that your board be willing to address this with you, Mr. Van Alstine. And so that's pretty much it, Mr. Chairman.
Okay. Does anyone want to make the motion to adopt this resolution?
I would make the motion, or should I not?
You certainly can.
Okay,
Moved by Mr. Mason to adopt the resolution. Is there a second?
I'll support it.
Been moved and seconded. Is there any further discussion? I would say respectfully, Mr. Mason, my own 2 cents again. I don't think it's the position of this board to dictate to any county who represents them on this board. Hearing nothing further, can we have a roll call vote, please, Mel?
Commissioner Levanway,
No.
Commissioner Aaron's,
No.
Commissioner Chamberlain,
No.
Commissioner Hankins,
No.
Commissioner Van Alstine,
No.
Commissioner Mapes,
No.
Commissioner Mason,
yes.
Commissioner Turnbull.
Yes.
Motion fails.
Okay. That moves us then again to public comment, ladies and gentlemen. Again, if you would like to address the board, you'll have 3 minutes to do so. I would ask you to step to the podium, state your name and where you reside. And then I will give you a 30-second warning when your 3 minutes is about to expire. Would anyone like to address the Board of Health? Yes, ma'am.
I'm Stephanie Jacobson from Otsego County, and I want to congratulate the board for the excellent discussion that you had, everyone, on the breastfeeding position. I do want to say that when you come to a board and ask for money, any sort of numbers you have help. I mean, we all hear testimonials, we all hear emotional arguments, but having some numbers to justify, are you making a difference? What is the rate of success? How many people are able to stay breastfeeding? How many contacts you have? I think that kind of stuff is very important and helps you all make an informed decision. So just going forward. I also think we're going to see an increase in breastfeeding naturally. Commissioner Mason alluded to that. I think there's a healthy distrust in government. I think there's concerns about where our food supply comes, especially things that are artificially manufactured. And I also think after COVID, there is a general distrust in the experts. And I would like to say that I don't think we're kind of shooting ourselves in the foot, because one of the unintended consequences of the WIC program giving out formula is breastfeeding rates have declined dramatically in this country. And we know that if you give young infants and new mothers formula right away, either in the hospital or as part of a program such as WIC, that they do struggle to breastfeed. So we've kind of created our own problem, and now we're throwing money at a solution. And that's kind of something that is difficult. I also know that for a very long time, physicians have pushed formula on new mothers. And I hope that's changing. Dr. Meyerson kind of alluded that it sounds like it is a little bit. And so that's very positive to see. That's big business, the formula industry. There's a lot of money behind it. They lobby doctors heavily to get children, doctors and hospitals to get children on formula. And then I'd also like to say, one of the commissioners alluded to the fact that there used to be a large network of women in mothers in this area that, or in all areas, that helped new mothers breastfeed. And they did that without the help of government. They did that without funding. They were available 24/7. I had a friend that was very involved in this, and that was called the Leche League. They wrote the Womanly Art of Breastfeeding, which is kind of the manual on how to breastfeed. And these women had seen it all. They had done it all. They did this on their own time and their own dime because they believed that breastfeeding was best for infants, which is what all the science indicates. So just because someone disagrees that government should do something doesn't necessarily mean that they don't want to see it done, and it can be done. And I hope we'll see a resurgence of that organization, because it really was wonderful and free to all of us. And then I just want to say, I do agree with my counterpart in the audience that issues amongst counties should be solved within those counties. So I wasn't supportive of the resolution on JRS. We have elections, they have consequences. These two commissioners or whoever else actions will be judged in the
30
upcoming
seconds.
election. So I think that was the right call. So thank you very much.
Thank you. Would anyone else like to address the Board of Health? Hearing none, we will close public comment. Commissioner comments. You have a 3-minute limit also, or 30 seconds, or something to that effect.
I'm good.
Mr. Van Alstrom, thank you. Ms. Levanway, thank you.
I'm good.
Mr. Mapes, Mr. Aaron's.
I'd just like to add that we did have a meeting right before this one, which was available on Zoom and was an open meeting that had a lot of data as far as the breastfeeding goes. So we were presented with a lot of information, and we did deliberate it quite extensively.
Thank you, Mr. Aaron's. Mr. Mason, anything? Mr. Turnbull? Mr. Chamberlain?
I'm good.
I have nothing further to add. Ladies and gentlemen, I would take a motion to adjourn.
So moved.
Second.
Moved, seconded, all in favor, say aye.
Aye.
Aye. Thanks, guys.